Hello, everyone, and welcome to this press conference. Mr. Legault, the mic is yours. So hello, everyone, or rather good evening. First, as you can see, we are now in a third wave. And just to give a bit of context of what this actually means is that we had a first wave where we had to go in lockdown. Then we had the end of the first wave where we ended the lockdown. Then we had the summer period. And then we had a second wave where we had to go back into lockdown. And lately, the end of the second wave, and we hadn't even yet had the time to end the lockdown that the third wave came upon us. All that to say that I understand Quebecers who are saying that's a lot of changes that have been announced in the past year, and it might look like we're changing things, but it's a situation that is changing. And I just want to tell you that perhaps this is not that great of a consolation, but we are pretty much in the same situation as everywhere else in the world. Everywhere else in the world, there's been three waves, or even some that there's a fourth and fifth, but we've had three, and so we are in a situation where Quebec is not living in another planet, so we have no choice but to go back into lockdown and then end it and then go back. The idea is to try to find a balance. And of course, when we go into lockdown, when we confine people, it's protect citizens' physical health. And when we end or try to end the lockdown, it's a lot to help with people's mental health. So it's a balance that is fragile. So I want to give a bit of a context about what the role of public health is. It is important to clarify that public health continuously gives us recommendations, but it's also important to say that at the end of the day, we are the ones to decide. I am the one to decide. And what I mean by that is that, I accept that responsibility. If somebody's not happy in Quebec, well, there is one person you can blame, and it's me. So I want to be very clear with that. And listen, it's nothing simple, because we can see it right now. There are some people who find that there are too many restrictions and others who find that there are not enough restrictions. So even if I wanted to please everybody, it is impossible. And that comes with the job, of course, when you're in politics. And as Bernard Landry was fond of saying, if you want to be loved, don't go into politics, buy yourself a dog. So it's part of the job. And I accept this, and I chose to be in politics, but it's important to say it. I accept that responsibility. I always have. So yes, I get recommendations from public health, but it's myself with Christian and our team who decide what we do and what we announce. So I think that that is an important thing to say. Now that that is said, we saw it yesterday, strong increase in the number of cases. We had 1,270 new cases, and yesterday we had over 1,600. And today we're heading towards that number as well. That means that there's a strong increase in the caseload, and now we have to look where that increase is. There are three regions, the same three regions, that are of concern to us: the National Capital, Chaudière-Appalaches, and the Outaouais. Honestly, in those regions, most particularly in the cities of Quebec, Lévis, in Beauce and in Gatineau, we could almost say that on our street or in our neighborhood, there's somebody with COVID. When we say that it is in the community, it's everywhere, and it's people from all age groups. So the situation in all three of these regions is worrisome, despite the measures that we announced last week. So the situation remains difficult. The caseload remains very high. So unfortunately, I am announcing that we are going to be prolonging the emergency measures. in those 4 places, that is Quebec City, Lévis, in Beauce, and in Gatineau, for an extra week, that is to say, until Sunday, the 18th of April, inclusively. So basically, the measures are the curfew at 8 p.m., the closure of all non-essential businesses, and all schools for an extra week. And as you know, that is really not our first choice, but the situation is serious in these places. Let's talk now about the cities of Montreal and Laval. We know that Montreal and Laval are regions that are very densely populated, and we could have expected that the number of cases would explode in Montreal and Laval. Of course, these regions remain places with a very high contagion rate, but we are not seeing, for the time being, a strong progression. However, what we've been talking about with the doctors and experts of public health, as well as the INSPQ and the INES, and everybody is pretty unanimous in saying it's coming in Montreal and in Laval. So, what is the percentage of chances? It's difficult to evaluate, but it is possible, and it's even, I would say, probable that it will happen. So, even though it has not yet happened, we want to add today some preventive measures, or actually one preventive measure. So, on the island of Montreal and in Laval as of Sunday. So, we have another 3 days for people to adjust themselves. But as of Sunday, unfortunately, we are going to put the curfew back at 8 p.m., which means that it will also help to better follow what is happening in residences and homes. And we hope that it is going to help us to continue resisting for a certain amount of time, because Montreal and Laval are very densely populated, and that means that if it starts to explode, it could very quickly create big problems in our hospitals. So for the time being, the situation is under control in hospitals, but if there were to be an explosion over the next few days or weeks in Montreal and in Laval, it would be very concerning for our hospitals. The other region that worries us is the Eastern Townships. In the Eastern Townships, we have to know that for the past few weeks, we had very few cases, but for a few days now, there is a very significant increase in the caseload. So the Eastern Townships for us is under high surveillance. Public health is keeping a close eye on the situation from hour to hour, and we can't exclude it. We know that Eastern Townships is orange right now, and if the trend continues, next week we may not have the choice, and we may have to bring the Eastern Townships into the red zones. And there's another 3 regions that we're closely following, the Laurentians, Lanaudière, and the Montérégie. So the regions around Montreal and Laval. For the time being, when we look at the number of active cases per million, the situation is about at half of what is being experienced in Montreal and Laval. But if we compare ourselves to further off regions, it does remain relatively high in terms of caseload. However, it's stable and has been in the past days and weeks. So we're keeping a close eye on what is happening in those regions. Otherwise, in the meantime, vaccination is going forward well. Honestly, it's extraordinary, the work that is being done with the vaccination process. This morning, we started offering the AstraZeneca vaccine to those who wanted, knowing what they were going in for to get that vaccine. I think it's the first time in my life that I'm happy to see waiting lists to go get vaccinated. Of course, it was the first day, and public health is going to be adjusting itself in order to be able to adjust the appointments. But I just want to say bravo to all the CEOs of the CIS, the CIUS, all the organizers, all the vaccinators, In a few days, they really did a lot of work so that we could administer AstraZeneca together with everything else we're doing. So bravo, bravo, bravo. And I'd like to remind you, we like to compare ourselves to others. And I had a phone conversation last night with the premiers of the other provinces, and I was really proud. There's Scott Moe from Saskatchewan, who is a little higher than we are, but Quebec is second out of the 10 provinces. And even when we look at the number of cases, there were certain provinces who were asking us what our recipe was. So with what we experienced last year, that did me a lot of good to hear those kinds of comments. So bravo to those who are vaccinating, and please, once it's your turn, please go get vaccinated. It is our passport to freedom. Now, the upcoming weeks are going to be critical. When we look at what is happening elsewhere, when we look at what happened in Europe, and when we look at what is happening right now in Ontario, in Alberta, in British Columbia, and we don't even need to go that far when we look at what is happening in the city of Quebec, in our national capital. Well, it means that it can happen anywhere. We are not safe from an explosion of cases every day in the following weeks. So we have to be conscious of the fact that there is a danger and that right now we are facing a variant that is more contagious, more vicious than ever, and we have to be more prudent than ever. And I understand that everybody's tired. It's been a year, but we've done a good part of the way. We have some left. So I'm asking you to show solidarity, to show courage in order so that we can get through those last stretches together.
We see that the third wave is getting stronger. Like many other places in the world, we have to bring back restrictions. I can tell you that I follow the data for each region very closely. Our challenge is to find a balance between mental and physical health. There's no magic recipe to succeed against the pandemic. We're having discussions with public health to find the best solution, but at the end of the day, I'm the one who make the decisions, and I take full responsibility. That being said, we continue to see significant increases of cases in 3 regions, Capitale-Nationale, Chaudière-Appalaches, and Outaouais. That's why I'm announcing that emergency measures in Quebec, Lévis, Beauce, and Gatineau will continue until April 18. In Montreal and Laval, the level of contagion is very high, and we expect it to accelerate even more. So as a precaution, I'm announcing that the curfew in Montreal and Laval will now be at 8 p.m. starting next Sunday. At the moment, we're keeping the schools open. We're also monitoring the region of Estrie very closely. If the increase continue there, we may have to turn the region in red zone. In Montérégie, Laurentides, and Lanaudière, the situation is stable, but we continue to follow the situation very closely. Meanwhile, we're continuing the vaccination. I would like to thank the teams leading this historic operation, and I ask you to get vaccinated as soon as it's your turn. The virus is present everywhere, and the variant is more contagious. I ask you to reduce your contacts as much as possible. I know it's difficult, but it's the only way to stop this third wave. Thank you.
Merci beaucoup. Donc, on va débuter la période de questions. Il y a des journalistes présents ici.
We will now start with the question period.
Donc, on va se limiter, s'il vous plaît, à une question et une sous-question par journaliste. On va débuter avec Jacques Bissonnet de Radio-Canada.
Messieurs, bonjour.
Mr. Legault, you say that the following weeks are going to be critical. The caseload is increasing everywhere. In certain regions, even in Montreal, it's going better, in Laval as well, but the caseload is still increasing. Why not just go all in? Why not do what Ontario is doing? 28 days and we fix a problem and we get to the end of the virus. Has that solution been thought of? First, I would like to clarify, and I often speak with Doug Ford, our measures are stricter here than they are in Ontario, and it's important to say it because they call it a lockdown. But apart from the city of Toronto, the schools aren't closed. Well, now they have their March break because they had delayed that, but they have no curfew in Ontario. So that is a huge difference. With us, they haven't closed down businesses. They've closed non-essential businesses only. So it has to be understood that they're not doing more in Ontario than we are, and yet the situation is worse when you look at it proportionally. Now, as others say, we can't, start shoveling snow that hasn't yet fallen from the sky. When we look at Montreal and Laval, we see no significant increase. When you see the number of cases or active cases, it's stable. There's a slight increase. So before closing down the schools, it has to be serious. Now we're bringing back an earlier curfew, but the schools, if we can save those, even just for another week or two, it is so important right now. About the vaccination, we saw that people are going crazy for AstraZeneca. It's incredible, despite the bad press that it's gotten. There's a craze for it. But we realize that as far as vaccination with appointments, there's still a lot of spots that haven't been taken. Is that a question of organization? Mr. Dube? Well, to be quite clear, there's been all sorts of numbers that have come out in the past few days, so I want to clear up the situation because I think that it is normal that people are concerned with that. But I can tell you, just to be very clear, I have what we call a dashboard that we keep an eye on every day that gives two numbers. This week, in the following 7 days, I have 31,000 appointments that are open. Of those 31,000, there's 9,000 that are in pharmacies. So it's up to the pharmacists who do the work every day to call their patients, etc. So there's about 20,000 left that are for 17 regions in Quebec. So when you take 21,000 appointments for the next 7 days, it's a minimum leeway that we have to continue being able to give appointments every day. So right now, we are vaccinating at least 300,000 people. So having some leeway for all of our 17 regions in Quebec, having 20,000 appointments that are available every day for when people call, I think it's the minimum that we can have. So, and I can tell you, we want to be so transparent that I've asked for that number to be published every day. So, I heard numbers of 270,000 appointments that were available. That is not the reality. The reality is that today it's about 30,000 for the two components that I talked about. Hello. Right now in Gatineau, it can take 2 days to have an appointment for a test and many days to be able to receive the result. And there's even many Quebecers that go get screened in Ottawa because the result, they get the result in the same day. What are you going to do to increase the efficacy of the screening system in Gatineau? Well, I'm very happy to get that question. I have to tell you because I'm not happy with what is happening in Gatineau. First, I think I've explained it already, but there's a part of things that we have to do ourselves. In Gatineau, we had problems with equipment. Some broke down. We had to replace them. That took time. We also had in Gatineau a problem of staffing. So in Gatineau and Outaouais, in general, it's perhaps one of the problems where we have the largest staff problem. We don't have enough. So what have we done since then? We have service corridors with Saint-Justine to be able to use their lab. We have even sent extra staff to be able to help the team on the premises because we found that we needed to get organized better. So if you're asking me today, between the situation that we went through, let's say about a week ago, compared to the situation today, there's already a very important improvement. But I do take responsibility for this. There were things that took place that explained the situation. It's up to us to correct them, and that's what we're doing right now. And in the past few days, the hospitalizations have increased throughout the province. Are we going toward postponing treatment and surgeries again? Well, that's my biggest worry. You heard Dr. O'Patterney. Up until now, we've been able to avoid that. So that is that we were at about 85% of operations. There might be some treatments delayed in the Outaouais region because we have a staffing problem. And up until now, and that is why we are following the hospitalizations very closely. I don't see any yet in the very short term, but I want to be prudent in my comment because that is what we're trying to avoid as much as possible. Up until now, with the private clinics that are operating for us, we are at about 85%. I'd like to go back to the popularity of the walk-in vaccination. With the upcoming steps and clientele to be vaccinated, would the walk-in vaccination is an option to open up with longer hours in clinics, mass clinics, or do you want to continue still with regular appointment taken? Well, we had a good discussion with all the CEOs, and I think that everybody is managing things a little bit differently, and I'll give you two answers. First, it was quite a success. And I think that we have to first thank Quebecers for having reacted so quickly. I have to tell you, on Tuesday, we got the okay, and this morning we're already vaccinating. I mean, I think that we have to congratulate ourselves. But I asked the CEOs, I've asked CEOs to be creative. Everybody received the proportion of vaccination, and some people decided to be open until midnight tonight. So that's the kind of reaction that I like to see, to say, well, we are in a situation of crisis. I think many people would have wanted to do that, but they couldn't. And I've been told that at the Palais des Congrès, they are also lengthening the times. And we're going to learn from that. Taking into account the craze, the popularity, some people say that they prefer to because they don't want to cancel an appointment. And I think that we are analyzing things, but we had never thought, I must admit to you, even in my most beautiful dreams of the past few days, I didn't think I was going to see so many waiting lists, even the Premier. But I think that that is what the pandemic is teaching us, and I'm going to end on that. There are things that we did not realize were possible, and then when we try them out, we realize that it does work. And that is why I wish to thank Quebecers for having been so flexible and our managers for having shown so much openness. I look forward to seeing the results tomorrow, and I think that we're going to keep adjusting ourselves over the next few days. That is all part of the best practices. Another file. It's very beautiful outside. A lot of people are thinking about their vacation. Parents are thinking about their children. Last year, day camps were canceled pretty late into the season. The Camp Association is asking to have a rapid decision taken. With the situation that we see with this third wave, are we already condemning that season? And are we going to have only day camps as opposed to summer camps? Well, we're looking at the situations. I think that we are very conscious of the fact that this has to be prepared in advance, or we're looking at that. What is going to happen is that we will be more advanced in terms of vaccination, and I believe that if there's a lot of these camps that do activities outside, some measures could be taken, because there are people who come from many different families, maybe wearing a mask. Anyway, we're trying to maintain that element as much as possible. But I am not Nostradamus, so I cannot, give you a guarantee. In a pandemic, 48 hours can be a lot. But the teams are working at trying to find a way to find the young people to be able to participate. It would have a lot of positive effects. Just for your for your question about walk-in clinics, I just want to remind people that as of tomorrow morning, for the AstraZeneca, it is on the Clic Santé website. So those who want to go, I had said it yesterday, but I mean, so many things happened over the past few hours. I just want to remind people that those who do want AstraZeneca, either in a pharmacy or in our vaccination centers, they can now do it up until Sunday, either as walk-in clinics or through taking an appointment on Clic Santé. Dr. Arruda, just to start with, you learned, as we all did, the death of a 40-year-old man this week who was very fit. To what extent do you fear that the new variants will bring very serious complications or deaths in young people, and how are you taking that into account in your decisions? Thank you for the question, and I wish to offer my condolences. Any death, regardless of the age, is very important, but this hits us a lot because we've associated the deaths and mortalities to the elderly. And there were some in the first wave, younger people. It's just that we didn't see them as much because, thank goodness, there's fewer deaths right now. There's fewer cases, or rather, I mean, there's more cases but fewer deaths. But it's clear with the new variants, with their greater transmission, some people are more at risk of developing, and certain variants do bring more complications with them. So we're going to be seeing that phenomenon, and that is why it's so important to maintain the measures that we have. Vaccination is going to become, for adults, people 16 and over, perhaps 18, an important solution, but in the meantime, I think that the best way to do things is to respect the guidelines. And of course, the limit is associated to the fact that it's with a lot of vaccines that we'll be able to reach as many people as possible. But in my opinion, it remains really pertinent to protect those who are at risk. There's no risk ever. We can't ever be at zero risk. And I want to tell you, even if you've been vaccinated, we have to continue with the measures. You have to keep using the mask and keep the 2-meter distance and hand hygiene. That is what the approach is. But my second question, you're bringing the curfew back to 8 p.m. in Montreal and Laval without any other extra measure. Is it because you believe that it is the curfew at 9:30 p.m. that explains the increase in cases that we've seen in Quebec and Lévis, amongst other places? No, it's a measure that is preventive. Of course, the curfew helps to reduce contacts. I think that it's obvious. Now, we don't want to go and close schools for the time being. So I think that it is something that is going to help us without creating huge problems. I understand that there are people who like to go out and walk in the evening, and there are people who finish work late, and we are going to be accommodating those people who need that. But it remains that I think that it's going to help. And it's preventive, as I was saying. For the time being, we have seen no explosions of cases in Montreal or Laval. But experts are telling us that it could happen over the next few days. So we want to make sure that if ever there is an increase, that it is as smooth as possible to help out our hospitals. I'd like to know, in Montreal, we didn't hesitate to have a pilot project to vaccinate people in Côte-Saint-Luc when we realized that the cases were going up. It worked really well. Why not use the same strategy? You're talking about agility, Mr. Dube, and you've talked about it a lot in the past few days. Why not use the same strategy in Lévis and in Gatineau to turn off those fires? Because we know very well that the essential workers are going to be vaccinated so quickly. So what can we do, others, and tell people to respect the guidelines? What is the solution in the case of these flare-ups? First, I'm going to let Dr. Arruda talk about it because I think that we have to be certain to have the correct results of that pilot project that was conducted by Dr. Drouin, and I wish to mention what excellent work she does in Montreal of keeping the cover or the lid on. But for essential workers, what I want to say as well, as of tomorrow, so people from Group 9 can start as well. reserving their spot on Clic Santé. So we're talking here about professors, police officers, etc. So there's a question of being able to vaccinate them. You know, a month ago, we didn't think that by now we would already be at Group 9. So I just want to tell you that there is a combination of vaccination and pilot project on what we're doing right now. But I would like for Dr. Arruda to perhaps comment on the case of the project. It has to be understood that the pilot project in Côte-Saint-Luc was a pilot project that has to be evaluated. So we are waiting right now for those evaluation elements. There was the availability of vaccines in Montreal. There was a very concentrated, specific situation in 2 territories within a specific community. So we wanted to see, and we're going to be evaluating the project. It has to be understood that if we show that we've managed to control, because when you say, you know, that it went well, we had to measure to make sure of that. Because with that strategy, with a limited quantity of vaccines, there are certain people who don't end up being protected. They're still at risk. So that is, it raises the question, you know, of the evaluation. So if we can show that it was efficient and we have, you know, more vaccines and we've advanced sufficiently in at-risk groups, it could be a strategy. But the fact of vaccinating to prevent intensive transmission in certain areas remains to be shown. It's not necessarily something that is exportable from one place to the next. It's more for like communities that are more closed in themselves and not open to others where it may work. Mr. Premier, when you started the press conference, you felt the need to defend Mr. Arruda by saying that you were the only one to blame. This time, are you the one who made the decision to extend the measures, or is it public health? Why did you feel the need to say that, to give that message? Well, I've heard commentators. Yesterday, I heard them that we blamed one another. No, we're together. We talk about things. We get recommendations every day. We talk about it, and very often, to get to the same objective of protection, there are many solutions to get there, and some are more applicable, and others aren't so much. We work together. But at the end of the day, I'm the one who makes the final decision, and I accept total responsibility for that. Some people might have interpreted that I was blaming the changes on public health. Listen, public health, and I said it yesterday, I much prefer that they change their mind rather than they, you know, through pride or whatever, they absolutely take a stand and refuse to change their mind. No, you know, every day with the new information, these are my recommendations for today with information that I have now. So we talk about it, and I would say that today there's a part that comes from me. To get back to the schools, you said that for the time being, the situation is not yet serious enough to justify closing them down. If we can keep them open another 2 or 3 weeks, it's better. Is that to say that it's inevitable that they will close down, though? It's not inevitable. And obviously, it's one of the first questions that we ask when we have meetings with the INES and the INSPQ. What are the probabilities that we'll get to June without having to close down the schools in Montreal? And I would like to have a clear answer, black on white, but they have a hard time putting percentages. So it's not impossible that we manage to get to the month of June, but it's not impossible that we will be forced to close down the schools to be able to contain the third wave. What we can see is that for the time being, there are no explosions of cases in Montreal and in Laval, although the number of cases does remain high. And we saw Luc Tremblay, the CEO of the STM, who deplored the fact that his employees who are in the field, you know, bus drivers, people who, that they're not considered essential workers. He talked about that today. And I think he was moved, I would say. Why? Why have they not been included in the group of essential workers? Well, the term essential worker is a term that is very, very broad, and that gives, it's not because people are not essential. The analysis that was done in the context where we have a limited number of vaccines is really based on, first, the risk that those people may get the disease and have complications. That's why, we target certain workers and age groups. And the risk that that person in working exposes vulnerable people is another thing, as well as the places where we have had outbreaks, places where we've really documented was places of transmission. There's a series of essential workers, in quotation marks, that are not yet in that category. They will be vaccinated through a broadening of the vaccination process. And we get it. And in the term essential worker, we should say high-risk worker, at high risk of complications in places where there's been a lot of spread. I think that would represent the situation a great deal better. And that was not done just by public health. We also spoke with clinicians. And when we look at the risk of people of developing complications, when we look at the areas that were affected, that is what we based ourselves to go with a list. Gentlemen, I'd like to keep going with my colleague's questions on schools. As he was mentioning, you said earlier on that before closing down the schools, things have to be serious, Mr. Legault. What is serious? There's 250 active outbreaks right now in schools. What is serious to you? Well, first, as I explained, and I don't want to look like I am putting the blame on public health. I'm the one who makes the decisions at the end of the day, but right now we do have a recommendation from public health to close down the schools in Quebec City, in Lévis, in Beauce, and in Gatineau. We have not received any recommendation from public health to close down the schools in Montreal or Laval. However, as Dr. Arruda often says, it's possible that next week we'll get to you with something different. But for the time being, public health and the government, we do not judge that at this stage, for the time being, that it is necessary to do so outside of the 4 sub-regions that I've mentioned. I'd like to get back to today's announcements, particularly what has to do in Montreal and Quebec. Now, you've just created, to a certain extent, another red zone. So we have zones that are like pale red, and then we have Montreal and Laval, and then we have the dark red emergency measures that you announced last week. Is it still the strategy to adopt the different colored regions and that mapping, and how are you going to do it so that Quebecers continue following all that they don't get lost in this map of colors? Well, first, it's all on the government's website, so yes, there are some green zones, yellow, orange, red. It's more serious measures in 3 regions, 4 cities, and there are the emergency measures for Montreal and Laval. It would be simpler if we only had 2 kinds of measures, but it wouldn't be so well adapted to each region and sub-region. So I believe that Quebecers today, we're announcing 2 things. We're announcing that we are prolonging the measures in Quebec, Lévis, Beauce, and Gatineau for an extra week. And we're also announcing that the curfew in Montreal and Laval is going back to 8 p.m. as of Sunday. So the measures that the people already knew continue being applicable, and we are bringing these adjustments. I agree that it's complex, but I prefer for it to be complex rather than badly adapted. I know that you like talking about businesses. I would like to take 2 minutes maybe to go back on the announcement that we made in continuity, the collaboration with private businesses on vaccination. You asked me a lot of questions on the vaccination capacity. I'd like to remind you that on the 19th of March last, we had asked businesses to raise their hand, the ones that would want to help us with the vaccination process, particularly in the months of May and June. So we emitted a communique online a few minutes ago. It's over 450 businesses that raised their hand to be able to help us out. For the first phase, which is going to be announced today. We already have 13 polls in our 18 regions for businesses in 8 regions. It really is the first phase, and the good news is that this is going to help us as of May, to help us with our capacities. There's other announcements that will be made for those businesses, but I wish, Mr. Premier, to thank them, because the businesses have experienced very difficult times, and to rally like that, everybody together to come and help Quebecers in their regions, in their municipalities, to be able to vaccinate their employees and the people in the region. I wish to thank them, and I really look forward to seeing them participate in the vaccination process, and we'll keep you aware of what is happening with that. And the objective is that that we have businesses ready to vaccinate in all regions of Quebec together with our network.
Bonjour à tous les trois. Je me demandais en premier lieu,
I was wondering what is happening in Quebec City. What are telling you the teams in the premises to explain those searing and rampant increases apart from the gym? What has happened in that region? Well, it has to be understood that what happened is the very quick introduction of the new variant, and there was a super spread event, that is the one at the gym, that brought close to 170 cases. Those people are in their communities, and their families. It's like a star that bursts. And right now in Quebec, there are cases all over the place in the metropolitan area. There's not in Montmagny or in Portneuf, but in the concentrated zone where there's a lot of people, there's an enormous amount of cases. And that is why we had to apply the emergency measures. It was done very quickly, which is typical of a profile of a new variant. My second question, I'd like to go back to the Outaouais region. People in the field, my colleagues from the Droit, are saying that there are up to 5 days of waiting right now to get results of screening tests. I understood Mr. Dube's answer earlier on that there are service corridors to use other labs, but I was wondering whether you were thinking of sending a kind of SWAT team like you've done in the spring in certain CHSLDs to be able to help out if there's a lack of staff in the Outaouais, and that Gatineau is a zone under special measures right now. Is that something that you are going to do to fix the problem? Well, listen, it's already done. I talked about it with Dr. O'Patterney. In the past week, we found one person, one experienced manager who is being added to the team and who is going to concentrate only on that point. We can already see an improvement because of her experience, but the team on the premises needed help because, as I said, there were many problems. So we're already on the case, and the people from Saint-Justin, amongst other places, are helping us out to try to bring back the situation correctly as quickly as possible. And the public health director asked us to have access to rapid tests, the Bambio tests, that are going to be able to be used in the context of outbreaks to get the results more quickly and to be able to do the necessary interventions. But we are following the situation very closely, as the minister just said. We will now go to the English questions.
My first question is 2 parts. First, can you clarify until when the 8 p.m. curfew is expected to be in place? And also, why are we settling right now for an 8 p.m. curfew? Would it not make sense to be more proactive in Montreal and Laval, considering that the situation is not improving in certain regions?
First, the curfew at 8 p.m. will be until further notice, so we don't put a final date. Second, we are still surprised to see that there's no explosion of cases in Montreal and Laval. So we can expect that it will happen eventually. So that's why we put this preventive measure with the new curfew. But we have to adjust our measures taking into consideration the actual situation.
And secondly, I know the list for vaccination priority was updated today, specifically for people with chronic illnesses. The list, though, is very specific in terms of what kind of chronic illnesses qualify, what kind of treatment they should be getting. So the people that are not on that list, who have chronic illnesses, will they be vaccinated alongside the general public? And if so, how do you justify that?
In fact, they will be the best place to be vaccinated will be in the pharmacies, because they have the list of the diseases and they can evaluate the chronic disease. So I would say that's probably the place. If you have a chronic disease, you go to your pharmacy and then they're going to be evaluating. As we told, the very, very high-level critical chronic disease that are going to be made in hospitals, because they need to get care in hospitals. But for the other ones, the people who had high blood pressure, diabetes, and everything, that's going to be in pharmacies. It's going to be a best way to make sure that you will receive the vaccine, and the pharmacists have received those lists and even can find in their clientele who's the kind of person who needs to be vaccinated.
So to clarify, the people who will be vaccinated in hospital are the ones specifically on the list, and then other people who also have the chronic illnesses can still at the same time book their own appointments at pharmacies?
Yes. In fact, I'm telling you that imagine you go to kidney filtration hemodialysis every 3 days. Those persons are going to be vaccinated in hospitals because they get care there. But if you're a diabetic, high blood pressure, chronic heart disease, your pharmacist can take care of you and will have doses for you.
Can I just add one thing on this? This is very important. For those people that cannot take the appointment on Click Santé, they just call their pharmacist and he will make the appointment for them. So just to make sure that the pharmacist is aware they can put their appointment in Click Santé, so they don't need to worry about that part if they cannot do it.
Thank you.
We'll go with CTV.
Good evening to all three of you. Now, I just, maybe we'll start, Mr. Premier, with something that you said a few weeks ago when you got vaccinated, and you said it today about balance, trying to find the balance to not lose people. And you also say today that you shoulder the blame for the decisions being made. Now, social media is certainly not a barometer for how the people feel, but certainly many of it in response, just to when you said that, have taken you at your word. Now, are you worried by returning the curfew to 8 p.m. that you could lose people, that this may be too much with the nice weather, that there will be some people that will feel this is going too far?
I think that the vast majority of Quebecers, they understand that we have to be careful, and I expect that they will accept the new curfew. Of course, there will be a small minority who would not like that, and they will be very present on social medias, I'm sure of that. But I think we have to take decision for the good of the population.
And a colleague from CTV National was asking, just looking at variants, how are they specifically driving decisions exactly to maintain and the rise that we're seeing with 71% of cases, keeping the restrictions we have in the 4 regions of concern, also looking at Montreal where they're lower but to a smaller degree. But how are the rise in variant cases particularly affecting decision making?
It's clear that the variance is an issue, and it's why we go to emergency I would say measures where there is a high peak of variance. It's why we went this way in Quebec. It's why we went this way in Gatineau, especially in that region, and for Chaudière-Appalaches and Beauce, and it's why we went that way. I think it's important. It's really, and we are adding new things. Just for example, on red and orange zones, if you go outside with somebody which is not from your family, but you are going to take a walk or playing golf, we will ask people to have a cover, visage, or a mask, because those variants are very, and you know, if you are seated 2 meters from another person, you are not walking, you are not doing sports, it's okay, you can have no mask. But if you're gonna play together or take a walk, it's very difficult to always keep the 2 meters. It's why we are adding those new measures. If you go outside in a group of 8 doing an activity, it's very important because the variants are very more transmissible, and we are taking more precautions because of this.
Perfect. And we'll just take 2 more questions from the people online, and we'll start with Jesse Faith from Montreal Gazette.
Good afternoon, Premier Legault. You mentioned the situation needs to be severe for you to decide to close schools. You also said you expect cases to soon increase in Montreal. Are you considering closing schools in Montreal at this point? And what exactly is severe for you in schools?
But I think that when you look at the figures, since a month now, the number of new cases in Montreal is between 300 and 400 a day. So with the presence of the variant, honestly, we expected that the numbers would be a lot higher. So far, we don't see a major rise in the number of new cases in Montreal, but with the density of the population in Montreal and Laval, and what happened in the past, what happened in Toronto, what happened in the world, we can expect that it will happen. So that's why, even if we don't see a very important increase in the number of cases, we already take some measures, including putting the curfew at 8 p.m. And if needed, we'll add some measures in the next days or weeks. But we have to adjust to the situation. We hope that we don't need to close the schools until the end of June, but it can happen. And at this point, we don't know. Nobody knows. The public health is not asking us to close schools in Montreal so far, but we follow that not day after day, but hour after hour.
Thank you. Dr. Arruda, if I may ask, from what your teams are seeing on the ground, could you explain a bit exactly how the virus is spreading so much in the Quebec, Lévis, and Gatineau areas right now?
Okay, that's related, I would say, to the new variant, and this new variant is very transmissible. And it happens sometimes, there is, we call it a super spreading situation. Like in the gym, there was a lot of people coming from different places who have been infected, even 170. Those persons get the disease, infected other persons in their communities, at work, at school, and that makes this big explosions of cases. And it's why, because of this highly transmission in the community, because of this specific situation, we decided to do emergency measures. And this kind of profile has also happened in Gatineau and in Chaudière-Appalaches region too. And I think it's something we're gonna look very every day. In fact, in Montreal, we had not observed that same high level transmissibility in a short period. They have been in control for a longer time. We, as our Prime Minister told, we're looking at history because there is some augmentation, and if it stays going up every day, we will probably at least put them in red, but we are following that. I can tell you almost 3 times a day looking at the data that is coming to make sure that we will take and be active, not too fast, but not late, I would say, in a way that I think it's going to be the good time to do it. And another thing too, our measures are very strong comparing to others. People think that we are, but we have curfews. We don't permit anybody to get inside of houses, which is different. Even in Ontario was 5 not a long time ago. So I think it's probably a good way. And in those places, and if we change level, be careful. There is this need for distanciation, masks, and hygiene. I will repeat that till the end of my life.
Donc, on n'a pas d'autres questions, donc c'est ce qui met fin à la conférence de presse.
Merci tout le monde.
Merci
Bonne
beaucoup.
soirée.
Merci.
Écoute, les grosses annonces, les Converse. Vous êtes prêts, c'est beau? C'est bon. Ouais. Donc bonjour à tous, bienvenue à cette conférence de presse. Excusez, j'ai un problème de son. Monsieur Legault, à vous la parole.
Bonjour tout le monde. Vivez la troisième vague. Donc, tout ça pour vous dire que je comprends les Québécois qui disent ça fait beaucoup de changements annoncés depuis un an et on peut avoir l'air effectivement de changer. Mais la situation change, puis je veux juste vous dire, c'est peut-être une mince consolation, c'est qu'on est à peu près comme partout ailleurs dans le monde. Donc, à peu près partout dans le monde, il y a eu mais nous, on a eu 3 vagues. Et donc, on est dans une situation où le Québec n'est pas sur une autre planète. Donc, on n'a pas le choix que de confiner, déconfiner, confiner, déconfiner. L'idée, c'est d'essayer de trouver un équilibre. Achète-toi un chien. Tu sais, donc, ça fait partie de la job, là, puis moi, je l'accepte, puis j'ai choisi d'être en politique, mais c'est important de le dire, là, moi, je m'assume, me suis toujours assumé dans ma vie, donc, oui, j'ai des recommandations de la santé publique, mais c'est moi, avec Christian, avec notre équipe, qui décide qu'est-ce qu'on fait, qu'est-ce qu'on annonce. Donc, ça, je pense que c'est important, hein? Puis aujourd'hui, on se dirige encore vers ce chiffre-là. Donc, ça veut dire qu'il y a une forte augmentation. Puis là, bien, il faut regarder où est cette augmentation-là. Il y a 3 régions, toujours les mêmes 3 régions qui nous inquiètent. La capitale nationale, Chaudière-Appalaches, difficile. Le nombre de cas reste très élevé. Donc, malheureusement, je vous annonce qu'on va prolonger les mesures d'urgence à ces 4 endroits-là. Ça veut dire Québec, Lévis, en Beauce et à Gatineau pour une semaine de plus. Ça veut dire que ça nous mène au dimanche 18 avril inclus. En gros, les mesures, ben, c'est couvre-feu à 8 heures, fermeture des commerces non essentiels, puis fermeture des écoles, de toutes les écoles, pour une semaine de plus. Vous le savez, c'est vraiment pas notre premier choix, mais la situation est grave dans ces endroits. If we continue there, we may have to turn the region in red zone. In Montérégie, Laurentides, and Lanaudière, the situation is stable, but we continue to follow the situation very closely. Meanwhile, we're leading this historic operation, and I ask you to get vaccinated as soon as it's your turn. The virus is present